Remember, whether a child requires a tongue tie release or not is not decided by seeing the tongue. A parent and a doctor should know that what functions are getting affected because of that tied tongue. Namaskar parents, I am Dr. Deepesh Prajapati, dentist just for kids, practicing in Jaipur, Rajasthan. Let's discuss in this video that what functions can get affected in your child if he or she has a tongue tie. See, one of the most common things which probably everyone knows is speech delay or problematic speech. We all know that if your child is not speaking age appropriate words, tongue might be a problem. But we also have to understand that you do not often find a grown-up kid who is still having speech issues. Speech is a functional issue like any other function, and the child eventually learns and tries to adapt that how quickly his tongue allows him to speak, which words the child cannot speak. So eventually the child gets adapted to speak well in the society, to get accepted by the society well. But there could be other functions which often get unnoticed and which keep on affecting the lifestyle of the child. My video is to make you aware about those symptoms. In my observations, a tongue tie kid might be too thin, or maybe a obese kid. A tongue tie kid might not sleep well, might snore at night, might keep your mouth open while sleeping. His lower lip might become thick and dry. When he smiles, you might be able to see too many gums like this, which is called as a gummy smile. The teeth might get crooked. I totally believe that if somebody does not have a straight set of teeth, the tongue has a major role to cause this. Anybody who is getting braces done, anybody who do not have a straight teeth should get his or her tongue evaluated. The other function which I can think is, I like to concentrate on food. These kids often do not prefer eating or chewing hard food. They always remain on the soft diet. Even if you give them something semi-solid to eat, they will pouch it in the mouth on some corner, make it wet with the saliva or drink water and then take it in. You need lot of functions from the tongue when you take the food inside. These kids often complain that they have difficulty deglutting or swallowing the food, so they are on the soft or the semi-solid diet, which eventually causes cavities as well. Because these kids do not sleep well, they mostly do not sleep on the back, they sleep on their tummy, they keep their mouth open, they might do bedwetting even after a age where it should be stopped. They might clinch or bruxellitate. If your child is bruxing, trust me, you should evaluate mouth breathing and tongue positioning for him. I have a video in my channel about this bruxism. I'll put it over the I button. Please go through it. Other functional issues which I can think of is they could be having reflex issues, very high gag reflex. Often they cough a lot, and while the pediatrician says the chest is all clear, it is usually seen in young kids. They have postnasal drips, they have adenoids, tonsils issues. So there are a lot of functional issues which you should be aware of, and I'm not saying that every kid with tongue tie will show all the issues. If you want, I leave a good questionnaire in the description section below. Please click it and fill it and see if those things are positive for your child. If you find many of the things which are there in your kid and you are trying to find treatment from any other specialty, please consult a dentist or a ENT doctor or a plastic surgeon who does lot of tongue ties and interested in the functional aspect of the tongue, and please get your tongue evaluated. Remember, whether a child requires a tongue tie release or not is not decided by seeing the tongue. A parent and a doctor should know that what functions are getting affected because of that tied tongue. I have seen enough number of cases where the child has the most possible tight tongue but doesn't has any functional issues, and the child has a loose tongue but has all the functional issues of the tongue tie. So you need an expert opinion after knowing what functional issues the child is getting affected because of that tongue tie. If you have any other doubt related to tongue tie, you can write it in the comment section or put your query on the email ID given below. I'll be definitely reply and happy to help. Namaskar.